Hey guys, it's Tiffany. So, it is 3:40 in the afternoon. It's Tuesday, May 14th. I had my surgical consultation today. Um, yeah, I had a few things going on. It lasted up until about 2:30. I've been home for about 30 minutes. And I got there at 8 a.m. Geez Louise, let me tell you, I'm so glad I was one of the first ones to go back and meet with the surgeon, because if not, I would have sat in that waiting room for even longer. But I sat in the waiting room for 2 hours of that period of time that I was there today. Actually, maybe more like 2.5 hours. I got there at 8 a.m. Then when you get there was a mass amount of people there. Really didn't expect that. I expected maybe like 7, 8 people. There were like 11 or 12 people there, which was really shocking to me. So then, oh my gosh, got a sharp pain. So then, I was sitting there, fill out paperwork, then you sit there even longer, you do all your business with them or whatever. Then they call you back one by one to do your blood pressure and to take your vitals. And then you go back out to the waiting room again, which of course everything was good. Rarely ever is my blood pressure. The only time my blood pressure is ever high is when I go to the emergency room. If I go to the doctor or anywhere else, it's always normal. But when I go to the emergency room, they call it white coat syndrome. That's where you kind of get like high blood pressure because you get anxious like in a situation, but around doctors. So anyways, so then you sit there forever. Then they call everybody back to go to the class with the surgeon. So we sat in that room waiting for probably 15 or 20 minutes for the surgeon to come in. So then when he finally came in, he sat down. He's really funny. Like he's made some jokes and he was pretty funny. And he's good looking too. And so he gives the whole spiel about, what's the things to do, the things to don't do, and all that stuff. And knock on wood, he is like an amazing surgeon. And do that. My hand's not wood. I knocked on my hand. He is an amazing surgeon. He has never had any deaths. He's never had to actually open a patient up to fix anything except for laparoscopically. He's only ever had 4 cases of bleeding, and all of those resolved themselves. So we're good to go. But so at my doctor's appointment, I got my surgery date, as y'all know. I am so excited. My surgery date will be June the 3rd. Now, I was really hoping for May the 27th without the thought in my mind at all that it was a holiday, because it's Memorial Day. So, they're closed. He only does surgeries on Mondays. So, since the Monday before was completely booked and they're not scheduling on the 27th, I had to wait till the 3rd. So, either way, the 3rd, 11:30 a.m., I'll be having surgery. I have to be at the hospital at 9:30 a.m. Since my BMI is under a 50, I don't have to take the Lovenox injections after surgery, so that made me happy. I have to start Actigol 1 week 1 week after surgery for 6 months after surgery. And then I have to do the Foltix 1 week prior to surgery. So, and that's for your blood. It's a blood thinner. And then I have to go get labs done like Friday or Saturday before my surgery. So, yeah, I'm like really excited to actually have this darn date in my hand now. They gave me a whole list of things. Oh, I forgot to go meet with her today. Talking about what to do, what not to do with your diet. I feel like there was so much I was going to say, and now I'm kind of like, what am I going to say? I have to go back and get more labs done, of course, right before surgery. I have to get a pregnancy test, a CBC, and a CMP. So that's what I have to get done before the before my surgery that weekend before. So I really feel like I had more stuff, more papers, but I guess I don't. Anyways, so I found out a few things that made me really happy. One, I will not have to have a catheter. And I'm really happy about that because I really didn't want a catheter. I think it's better because, one, it's going to have to make me get up to walk and pee. And 2, I just didn't want a catheter. They're not fun. So, that was exciting. He doesn't do catheters. He has you pee right before surgery and then he takes you back. So, the next thing was, I don't know if it's in this book. I don't think it is. I feel like I've seen a picture somewhere, but I don't remember where. Maybe it was the slideshow I'm thinking of. The other thing is I will not have a drain. I don't know why, but he doesn't use drains. He says he didn't find them to be that useful. He used to use them, but he does not anymore. So that's exciting that I won't have to have a drain. And then the other thing is he has this thing, what's it called? I don't know. It's got like a guy's name. And essentially, he puts it into your side over here, and it has these two tiny little cords, literally just like little slits that fit down into your stomach, and it feeds a drip that's like Novocaine into your or onto your stomach to like numb it so it doesn't hurt. So it's like this little pump. It's like a little ball about this big, and it's got these two long like wire looking things, and they go in there and they numb it. So that was awesome. And he said it doesn't hurt at all when they come out. They come out just fine. They're really tiny little pieces of like almost like floss or thread. I don't know. So that was exciting. He said he was kind of worried about me with the pain meds because of codeine. I'm not supposed to have codeine. And I guess apparently that's in pain meds. See, I don't take pain meds, so I don't know that. So I told him I was nervous about the pain meds today because I was worried that I would have a bad reaction to them. And he said, we'll switch it up if anything's wrong. So we'll get to go in that aspect. But he said they do the liquid Tylenol via the IV. And then right before surgery, they come in and give you an injection to a blood thinner. And then, of course, you wear the booties that pump the blood, massage your legs to keep the blood pumping during surgery. But yeah, I was excited to find out no catheter, no drain, because I've heard so many of y'all bitch about the drain. And I'm actually really excited. No drain, and no catheter. Then she kind of confused me, though, because when we went back to meet the dietitian, she was talking about the drain, and I was like, I swear he said no drain when he was talking. So I think that, because she wasn't sure if he still used I don't know what it's called, the system with that I was telling you about, the Novocaine thing, but he told us he still used it. And then I'm pretty sure, I'm like 99% sure that he said he is not going to have a drain, that we won't have drains. And she was talking about the drain, so it kind of confused me, but I'm pretty sure I'm good to go, because I'm like 99.9% sure he said no drain, because we all kind of looked stumped when she was talking about it. But yeah, like I was the third patient to go back to get to meet with the surgeon one-on-one and then meet with the scheduler, so that was good. It means I had an earlier choice of dates. He actually thought I was going to be able to go as early as next Monday, but then he found out it was booked. And then, of course, the following Monday, they're not in the office. I had to wait till the following. So, June 3rd, still can't complain. It's like 20 days away, guys. I'm excited. That gives me time to prep, mentally prepare, get things taken care of at work, not have to stress about stuff. But I got, of course, I think it's called a spirometer or a spirometer, I'm not sure. But we got this little doodad today, and she was making us practice. We felt kind of stupid. And then we got this. This is called, what is this called? A acapella. And essentially, when people have cystic fibrosis, they develop this mucus in their lungs. So, like people pat their backs really hard. This is taking place of that. So, like, when you blow, it like makes this vibration in your lungs, and it makes them expand and makes the I think it's called villi. I think it's pronounced the little maybe like hair things. I can't remember. And your lungs stand up and kind of like open up, so your lungs, because your lungs will collapse during surgery, so keeps you from getting pneumonia. So yeah, lots of good stuff today. I was really excited to get everything taken care of, and I was really excited to get a surgery date. Yay, June 3rd, 20 days. And, yeah, I'm pre-registered already. I've got to get, some of the stuff still for the hospital. But other than that, I'm good to go. So I'm going to go. I'm trying to watch Dr. Phil, and it's going off in like 15 minutes. But I'm going to upload this, and I will talk to you guys later. Bye.